Hello, my name is Kirsten Giblin, and I'm a level 3 nursing student here at Central New Mexico Community College. Today we're going to be doing a presentation to discuss endocarditis, or infective endocarditis, also known as IE. IE is an infective valvular disorder of the heart valves that progresses very rapidly in critically ill patients. Endocarditis is most typically caused by bacteria, either staph or strep, however can also be fungal or viral in nature. Once the causative organism is introduced into the bloodstream, it travels via the circulation to the inside of the heart, whereupon it affects the heart valves. As the causative organism begins to establish a foothold, they form vegetations on the heart valves. Vegetations are the primary lesion formed by infective endocarditis and are composed of fibrin, white blood cells, platelet aggregation, bacterial fragments, and pieces of the endocardium. As the disease progresses, progressive erosion of the heart valves ensues. As the heart valves begin to erode, multiple emboli form and go into circulation and affect multiple different organs and different parts of the body. There are cardiac and non-cardiac risk factors which can predispose a patient to developing endocarditis. Cardiac causes of endocarditis include previous heart valve replacement, previous endocarditis, rheumatic heart disease, Marfan syndrome. And non-cardiac causes of endocarditis include hospital-acquired septicemia and previous exposure to IV drug use.
My name is Kirsten Bialy, and I go to CNM Nursing School in level 3. I'm not feeling well, so I came to the hospital because I think I have endocarditis.
Knock knock, hello. My name's Max. I'm going to be your student nurse today. What seems to be going on?
I'm just not feeling well.
So tell me, when did all of this start?
It started last week.
And can you tell me the symptoms that you've been experiencing?
I'm just really tired. I'm getting like these weird red dots on my hands, and I don't know. I mean, they don't hurt or anything, but they're just getting there, and I'm having some like purple dots on my feet.
I noticed a scar on your chest. Have you had a previous heart surgery?
Yes, I had it like 4 months ago.
And what was the previous heart surgery?
It was a valve replacement.
Okay, and I looked at your note on the computer. Said that you had some recent dental work as well?
Yeah, I came here for
Okay.
that.
Any bleeding or anything like that in the gums?
It has.
Okay.
It's just been bleeding really hard.
Can I just take a quick look?
It's just like in here.
Okay,
My
all right.
gums.
Got it.
It's just really.
Any pain in your chest, shortness of breath?
Yes.
Okay.
That's why I came in.
And you've been running a fever, they said?
Yeah.
I was looking at your triage vital signs. Go ahead,
Yeah.
take a big breath for me real quick. Out. Again. I'm gonna listen on your back, okay?
Oh, that's hurting.
Is it hurting?
Yeah, just the
All right.
bleeding.
Just go ahead and lay back for me real quick. I'm gonna listen to your heart valves, okay? Just breathe normal. Okay. I'm gonna have you lift up your shirt for me just real quick. Okay. Do you have a previous heart murmur?
Yes, I do.
Okay, and did that get like fixed once the heart valve was replaced?
I'm not sure. I don't really know anything about that.
Okay, I'm gonna go read up on your chart and we're gonna kind of go from there. Okay, the doctor's gonna be in here to assess you as well. He's probably gonna order some lab work and some more things to kind of follow.
Right. Is there anything you can give me? I'm just so tired.
I'll talk to your nurse and we'll get you in a comfortable position. We'll talk to your doc and see about maybe getting something to make you a little bit more comfortable. Is there anything else that you need from me?
No, I think so.
All right, please let me know if there is. This patient that we just assessed is presenting classically for endocarditis. She's febrile, she has general malaise, and she has a recent source of infection. She had recent dental work, which really predisposes individuals to developing endocarditis. In conjunction with this, she's had a previous heart valve replacement for a pre-existing condition. And finally, the patient presents with Osler nodes and Janway lesions, both of which are hallmarks for endocarditis.
My name is Tiffany Bialy, and I am a level 3 nursing student. I am working on endocarditis, and I'm going to be discussing the diagnostics and lab results with the patient. Hello, how are you doing today?
I'm not feeling well today.
Not feeling
Yeah,
well?
I'm just really tired.
Okay, well, my name is Tiffany. I'm a student nurse, okay? I'm here to talk to you about some labs that we're going to run on you, as well as some diagnostic studies that we're going to have done, okay?
Okay.
First, what we're going to do is we're going to take some blood cultures. That's going to tell us if there's anything growing in the bloodstream that's not supposed to be. Next, we're going to go ahead and take a CBC. That'll help analyze for infection. We'll also do a BMP, which is going to give us information about your kidneys. And then lastly, we're going to take a culture of lactate.
Oh,
And then that's going to give us information about maybe sepsis that you may potentially have.
okay.
Knock knock. Hello.
Hi.
I'm sorry you're still not feeling so well. So I talked to the doc. He put in some orders for some antibiotics. The antibiotics.
What is an antibiotic?
So antibiotic is going to help to kind of kill off infection.
Okay.
So what that does, there's wide spectrum antibiotics and narrow spectrum antibiotics. Because we don't know what's causing your infection right now, we're going to get you some wide spectrum antibiotics until we could figure that out. We drew some blood earlier. The blood that we drew is one of the things that we drew is called a blood culture. And once we're able to determine what's growing in your blood that's not supposed to, we could more narrow down our antibiotics. You also have a fever, so he's ordered an antipyretic, which is called Tylenol or acetaminophen. And
What you get at Walmart.
yeah, basically, yeah.
Oh,
It's like over the
okay.
counter, so it helps to control your fever. And he's also, if you are in any pain, we could kind of broach that subject when we come to it, sort of thing.
Okay, yeah, it's just
Cool.
the fever.
It really wears you down
Yeah,
after a while.
Yeah, I'm trying to rest. And
Cool.
just,
So I will get that medication, and if there's anything that you need, please let me know. Okay.
Okay.
All right.
All right. How are we doing?
I'm a little better with
Yeah.
the antibiotic that
Good.
they gave me a while ago.
Okay, good. Well, I'm here to talk to you about your lab results. They did come back abnormal, so they are indicative of a possible infection. You do have growth of strep. There's increased lactate, and there also is an increase in your white blood cell count. So the doctor, he's going to put in some orders for some diagnostic studies to be done. And then in regard to that, we're going to do an echocardiogram, a chest x-ray, and an electrocardiogram.
All of those today.
Yes.
I'm really tired. Does it have to be now?
It does. It's in your best interest because you do have a possible infection in your heart, which, you know, is indicative of endocarditis.
Oh, okay.
So we'll go ahead and get the doctor's orders, and then we'll go ahead and take you down to get those labs done and the diagnostic studies.
Okay.
Okay. So the diagnostic studies for endocarditis consist of an echocardiogram. That is an ultrasound that looks at how well the heart is pumping, as well as vegetative growths in the valves, which may be indicative of heart failure. Another diagnostic study is going to be a chest x-ray. The chest x-ray detects cardiomegaly, which is an enlarged heart, and that can be caused by inflammation as well as the heart having to work harder. And then lastly, we have an electrocardiogram. That test will show first or second degree heart block. And the heart block will occur because the heart valves lie close to conductive tissues, especially the AV node.
Hi, my name's Lindsay Cabbage, and I am a CNM Level 3 nursing student working on the presentation of endocarditis, and I'm going to be going over the nursing diagnoses and the possible complications. The possible complications are going to be heart failure, sepsis, and heart block. So heart failure is caused by erosion of the heart valves, which causes the heart to pump ineffectively. Heart failure is identified by doing an echo, doing a cardiac assessment, and lab work. Sepsis is identified by doing a physical assessment and doing blood work. The usual manifestations of sepsis are going to be a high pulse rate, a low blood pressure, a high temperature, and an elevated white blood count. A heart block is a blockage of the normal electrical pathways of the heart, and it is identified by an EKG. The first nursing diagnosis for endocarditis is going to be activity intolerance related to reduced cardiac reserve as evidenced by weakness, fatigue, and shortness of breath. The second nursing diagnosis of endocarditis is going to be a decreased cardiac output related to the inflammation of the lining of the heart and increased myocardial workload. As evidenced by a heart murmur, an S3 heart sound, a tachycardia, diminished peripheral pulses, and adventitious lung sounds. The third and final nursing diagnosis for this patient with endocarditis is going to be hyperthermia. It is related to the infection of the heart valve. as evidenced by her temperature elevation, diaphoresis, chills, malaise, tachycardia.
I was just going to double check the computer. I believe, if I remember correctly, it was saying that you have a physical therapy and occupational therapy evaluation to come in and take a look at you. Now, the reason for that is anybody that's weak in the hospital gets an evaluation through PTOT to determine what their safety level and what their risks are while they're in the hospital, as well as potential follow-up after their discharge.
Okay, and then like what about the food? Because I just feel like they're too big and it's really hard for me to swallow.
Large
right
portion
now.
size, you're saying you're having a hard time chewing it because of your dental work?
Yeah.
So I'll talk to the doctor. You're in for a regular diet currently, but we could put a regular diet, easy to chew diet in for you.
Okay.
One of the many lab or diagnostic tests that you may also have while you're here in conjunction to the EKG, chest x-ray, and echo is you may have a diagnostic catheterization. And what that is an interventional cardiologist will go in, put a little catheter in your arm, in the artery, and then go thread a guide wire into the arteries that surround your heart to see how well it's pumping and see how well the perfusion is taking place as well.
Okay. Is there like any chance I'd have surgery again?
Surgery is a possibility, and the reason for that, you do have vegetative growth on your heart valves. So if we are unable to get the antibiotics to clear up the infection, and there is progressive damage to the heart valves, then there is a chance that you may need a valve replacement surgery.
Okay.
So I understand you had a question about your lab work. You've been getting,
am I going to be going home soon?
so you've been getting lab work every day to kind of see the progression of how well the treatment's working.
Mm-hmm.
So your white blood cell count's been going down. It's been trending lower and lower, which is a sign that the infection's going away. However, you still have infection, or you still have bacteria in your blood cultures that we've drawn.
I just feel a lot better right now.
And I understand, but here's the thing. If you stop treatment and you don't continue it all the way through, there's a possibility that it's going to come back and be even worse again. So we don't want that to happen. So when you do go home, there's a strong possibility that if you have heart valve replacement and all that other stuff, and after all that rehabilitation, once you do go home, there's a possibility that you might be on IV antibiotics for a long period of time. And what that would entail is that they put a PICC line in your arm, and then an infusion nurse would come over however many times a week and then give you the proper infusion to continue your antibiotic care so this doesn't become a chronic issue.
So do you guys just give me all my medicine now when I leave?
So the doctor will write for prescriptions and will coordinate with the home health agency to
so
do your
I'm
infusions.
just at home
Yeah.
and you come?
You'll be home, schedule a time, they'll hook it up to your thing, infuse it in, and then you go on your merry way.
Okay, well, like I can't take care of an IV, so
So an IV is a little bit different than a PICC line. So a PICC line, IV is like in your arm, and they get changed out every so often. A PICC line is a peripherally inserted central catheter. So what that means is they go in like an IV in your arm. They usually go up here, they insert it, and it goes into close to your heart, and it just stays there. The dressing stays, and then a PICC nurse, after insertion, will periodically come and check on the dressing.
so I don't.
You don't have to worry about it. No,
okay.
it's all taken care of for you.
All right, well that's all I had because I'm like I don't know anything about this medicine
It's a lot,
stuff.
and it's a lot, and I'm sure it's stressful with all this going on. So, is there any other questions that you have, or anything else that I can answer for you?
I think I got all the necessary questions I had and everybody else that I need to see to
Perfect.
get more information in a specific area.
Cool. Well, I hope you feel better. Okay.
Thank
All right.
you.
Let me know if you need anything.
Yeah.